Okay, well, welcome everyone. We'll get started. Thank you for, I think a few more come in as the link comes through to them. So welcome to the HDR UK internship program for hosts. It's wonderful to see you all here. We're going to be today, what we're going to do is I'm going to start off by doing some quick introductions. So we'll give a chance for everyone to know who everyone is. We'll then give a little bit of an overview of the program last year, give me a bit of context as to how the program got set up and a bit of background to it. And then we'll focus on the year ahead. So really want to make plenty of time to ask any questions and talk through any aspects. So my name's Caroline Cake. I'm Chief Exec at Health Data Research UK. I was very involved in the programme last year, and so we'll be able to kind of talk through what's and all of the experience on that. Sarah.
Hi, yes, I'm Sarah Cadman. I'm Programme Director Talent and Training, and I'm overseeing the programme this year.
Rosie.
Hi everyone, my name is Rosie Waken. I am Head of Training at HDR UK.
Melissa.
Hi, I'm Melissa. I'm Head of Research Data Strategy at Cancer Research UK now.
Ashley.
Hi, I'm Ash. I'm Media and Content Officer at HDR UK, and I'm managing the comms of this program.
Alicia.
Hi, I'm Alicia Morgan, Programme Manager at Swansea University.
Michelle.
Hi everyone, I'm Michelle Mugi. I'm Programme Manager for the DARE UK programme at HDR UK.
Donna.
Sorry. Hi everyone, I'm Donna. I'm the Training Coordinator at the Rosalind Franklin Institute.
Sarah Scobie.
Hi, I'm Sarah Scobie. I'm Deputy Director of Research at the Nuffield Trust, which is a health policy and research think tank.
Brenda.
Hi, I am Events Officer at HDR UK, so just going to be doing the event side of things.
James.
Hi everyone, I'm James. I'm the Training Support Officer at HDR UK.
John.
Hi, I'm sorry, I don't know if that's come through. I'm John Illingworth. I'm Evaluation Lead at ECL Partners.
Hi, John. We couldn't see you, but we heard you, so thank you. Everyone's jumping around. Pia.
Hi, everyone. My name is Pia Hardlid. I'm Associate Professor at the UCL Institute of Child Health.
Great. Tamsin.
Hello, I'm Tamsin Street. I'm a Research Fellow at Salisbury NHS Foundation Trust.
Sven.
Hi, I'm Sven Bunn. I'm Programme Director for Barts Life Sciences at Barts Health and Queen Mary University of London.
Laura. Don't know if Laura's heard me there. There you go.
Hey, sorry, yeah. Hi everyone, I'm Laura. I'm the People Support Manager at HDR.
Thanks, Laura. Isaac.
Yeah, hi, I'm Isaac Barker. I lead healthcare analytics at Bupa. Look at the care we commission for our members.
Great. Rebecca.
Hi, I'm Rebecca Hoyle. I'm Associate Vice President for Interdisciplinary Research at the University of Southampton.
Great. Karina.
Hello, I'm Karina. I'm a Senior Strategic Partnership Manager at Cancer Research UK.
Neil.
Hello, I'm IT Lead at the NIHR Bioresource, Chief Data Officer of one of the HDR UK hubs.
Greg. Don't know if Greg can hear me. I'll go on to Jim.
Hi, I'm Jim Briggs. I'm Director of the Centre for Healthcare Modelling and Informatics at the University of Portsmouth.
Good. And Greg, I think you came back on then. I think I can see Greg's trying, but we can't hear you, Greg, unfortunately. Do you want to have a go and then let us know when you're back in and things? So a very, very warm welcome to everyone. I mean, you can already see by the organisations that we've got involved in this. Oh, Michael, I don't think I had you. Hello, Michael. Hi.
Hey, Caroline, nice to meet you. Michael Cook, Executive Director of Epidemiology at Our Future Health, which is a new charity
for a large cohort study here in the UK.
Wonderful. Well, what an amazing group of people and organisations. So thank you all so much for joining, for being involved in this. I just wonder if anyone can find their reactions button, and it'd be great if you can pop your hands up if you were involved in it last year, if you hosted an intern. So just to get a flavour of how many people have been involved previously. Oh, very quick off the button there, Neil. Lovely. Good. So we've got a mix of, and I think all the HDR UK people obviously are very familiar as well and things like that. So we've got a mix of those who have, but actually lots of new people, which is actually absolutely wonderful. What I'm going to do is give a little bit of an overview as to the programme and what we've been doing so far. And then I'll be handing over to Sarah, who's going to give the kind of setting out the plan for the next year. And then we'll make sure we have lots of time for questions. But do, if you want to, as we're going through, I'll have the presentation off my screen, so I won't necessarily see hands. But do flag or just call out as we're going through if you've got any things you want me to pause on a bit longer, me or Sarah to pause on. So if I just share the screen, there we go, hopefully coming up. Is that working for everyone? Let me just pop it onto the full screen. Lovely, I'm just putting on the full screen. There we go. Great. So the kind of background to this program is, as many of you will be very aware of, is the findings that there really are very few Black scientists in the UK. And there were various articles that have been published over the last year associated with this. And I've got on the right-hand side is a picture of, this is HDR UK back in February 2020. And you can see at that point there, there are no Black scientists within our community there. Lots of fabulous diversity and great people in that, but actually we do feel we need to grow our community further from that point of view. And lots of fantastic scientists who, Black scientists across the world, different expertise, different areas. And making wonderful contributions to the field of science. And so what we really want to do is take tangible actions that grows community within health data research, so we can benefit from this amazing talent that we're just not drawing on enough in our field at the moment. So we held the first program, so we initiated last year, and that was the first program that we set up in 2021. And we brought together 48 interns. So when we initially started it, we hoped that a few organizations would get on board and that we might be able to hold maybe 10 or 12 internships just to get things started. And it really did really kind of grow very rapidly and was hugely exciting to see. We actually ended up with the 48 interns. And what we also found, and we did last year, was just a 6-week internship because we wanted to make it as really easy that organizations could feel they could sign up to, and just wanted to reduce the barriers in any way. So we thought, keep it short, make it and see if we can run something effective from that. Some of the nice things that we saw, that actually once the way we got it started, we ended up getting actually a kind of breadth of people, not only in terms of we had new Black interns, but actually 30 of those interns, 30 of the 48 were women, which in health data science is actually quite unusual. So it felt as though that we were almost signaling to the community and things, actually, this is a welcoming, open place that you want to be doing and getting involved in. So it did seem to address wider diversity issues as well. The whole of the internship was done remotely last year, and we had some wonderful experiences that the interns had. So some of them were actually got to meet with Patrick Vallance, which in the middle of the pandemic was a huge privilege given everything he was addressing at the moment at that time. And they also had, during the internship, and we'll talk a little bit about the kind of structure of it, they got to speak to different career speakers who talked about the careers that they created in health data science and how they got there, and just really helping people to think through and open their minds as to what their career could look like in different areas. And what was amazing was actually the work that they produced in the time. So it was only 6 weeks, but they produced some fantastic outputs in that time, worked on team challenges, and we've published some of the outputs on our website, so you can have a look at those. These were the organizations that were involved last year, and huge thanks to those ones coming on board. And you can see that from across here, the diversity was fabulous as well. So having organizations from NHS trusts, but also from universities, from charities, from all sorts of different parts of the health data research community. And the reason why that was so important was it showed people, as interns coming into this field, it showed the diversity of extraordinary experiences you can get as a health data scientist, and the field that where your career could take you to. So it really is fabulous that the more organizations coming on board, we really can showcase the breadth and the fantastic opportunities you can have as a health data scientist. We had our advisory group were a very important part of shaping the programme. It's chaired by Martin Levermore, and this group helped us work in designing the approach, the structure, how we actually reached out to the community. So, for example, if given the number of Black health data scientists there are, if we were just to go out through the health data science community, we wouldn't reach people to actually promote it to them. So we had Beverly, for example, getting us connected into the church groups and into the kind of the West Indian community within the UK. So really creative approaches of how do we actually reach people to send the message out that we want you to get involved in this. So the program we created last year so I mentioned it was 6 weeks. We're actually going to be looking for the year ahead, which Sarah will tell you a bit about, taking up to 8 weeks. The program had a comprehensive training program, so we had which ran on a kind of weekly rhythm. We had career speakers who gave up their time, and all of the interns came back together to join these group sessions. And on the Friday, we had a kind of takeover session each Friday, which was hosted by a different organisation, so that everyone got a chance to. They might be having an internship with, say, a Cystic Fibrosis Trust, but then they got to see, experience the wider host organisations on that Friday, every Friday. They were also given a technical challenge, which some of our previous interns within HDR UK had actually set them. And they then ran that for the duration of the 6 weeks and presented back in a competitive format. They were in different groups they were working in, and all the groups then presented back their findings and their insights. And it was absolutely fantastic to see the different ones that came together, and really was wonderful to see the kind of work they'd managed to produce in that time. They also each had a mentor. So, and I'd encourage you from your organisation to think about whether anyone would like to become a mentor. So they and the mentors met with each of the interns during their experience, and this is to give them a kind of one-to-one experience, kind of conversation, helping them think through what their career opportunities, what their kind of how they're experiencing the internship, and helping them to kind of process and think through what they want to do next. And that was really positive, not just for the interns, but actually for the mentors. It was really enlightening for all of us who are mentors to hear the lived experiences of other people and how they've been navigating some of the challenges of coming into this field of science. And Sarah will mention further about our virtual learning environments. So all of the interns had access to that, which gives them all sorts of bite-sized training programs and more in-depth training programs to help them really build their skill sets, and also to build the LinkedIn community around them. So they really are part of a cohort of people and relationships, which, as we all know, is so important to developing your career. And I'll just show you, there's a few quotes from different people who are involved from some of the interns, and really helpful to kind of see what they found as valuable. It's a nice one here from Shukrat. And what I think has blown us away, not just from the amazing group of interns who've been involved, but actually what the impact that just a 6-week internship has had on them already. And I don't think we were quite expecting how much difference it was going to make. And it'd be quite interesting to explore why that was so much. So many of them have now moved into paid roles within health data science. Many have gone, so here's a nice example here, talking about actually now doing a job at Leeds Institute for Data Analytics as a data scientist. And one of the things that we came away with the advisory group was actually reflecting on there's this amazing amount of latent talent that just isn't being tapped into, doesn't know how to navigate and find its way through into our field. So by opening a door, what we found actually, we were getting people with far greater experience and kind of background in areas who were very much ready to make quite big steps into this field already. So I think it's actually, you might be surprised by the kind of the breadth of experience you'll see coming through when during the selection process. And this is a lovely quote from Evans, which just wanted to include in there. I think kind of saying that story of actually the confidence that it's given people by being part of this program, being part of a community, getting that first experience of being able to get in there, had actually really helped him to make kind of steps into this field, and which is just wonderful then to see that he's now working in Nottingham as a research software engineer as a result of this. So at this point, so that was the program from 2021. I'm now going to hand over to Sarah, who's going to tell you the story about 2022, so the year ahead. Sarah.
Thanks, Caroline. So first of all, just opening up with a few key dates for you. We're looking for sort of confirmation that you are happy to be a host organisation by the 7th of January. And then the intern applications process is ongoing at the moment. We open that up in late November, and we are finalising, the application will be finalised on 21st of January. And then interviews will take place between February and April, and we're asking for host organisations to conduct those interviews, and I'll go through that process a little bit more detail a bit further on. And as Caroline mentioned, feedback from last year's interns was that 6 weeks was just not long enough, so we're extending to 8 weeks for this 2022 cohort. And just in terms of numbers, number of host organisations that are either signed up or expressed interest are 32. And we've already received over 200 applications on our recruitment system, and there's another 400 sitting within the 10,000 Black interns recruitment system. So you can see that the response is absolutely fantastic. So the more host organisations that can take more interns, the absolute better for this this coming cohort. Next slide, please. Can you move this?
Sorry, Sarah, it's just not moving for some reason.
Oh, is it not? Okay.
I'm kind of pressing away. Oh, there we go.
So in terms of the recruitment process, it's a process that worked really well last year and that we're keen to continue this year. So we've got our own recruitment platform called Applied, and really it's designed to remove many of the barriers for a fair, unbiased recruitment process. So candidates apply online, they have to answer 3 questions. One is around their motivation for being on the programme, and a couple are slightly more technical, but really asking candidates to think about sort of health data science generally. So they're not required to be experts, but they are required to think through some health data science questions. We are going to do the sifting process, so HDR UK will take that burden away from you. We expect, as I said, probably about 1,000 applications at the end of the process. And what you'll get at the end of that process is at least 6 or 7 candidates per placement. And what we're going to try and do is make sure that you've got a wide range of candidates. So candidates from undergraduate, master's level and PhD. And we'll also look at making sure that you've got a wide skills sets to draw on. And then in terms of the project, we require you to obviously put together a project for the interns that they can deliver across their 8 weeks. And we're really flexible about how you do that. And the suggestion really is that once you've interviewed the interns and got understanding of what they're interested in and what your needs are, that you'll be able to put together a suitable project. Next slide, please. So at the moment, we've got a huge campaign, thanks to Ashley, promoting the programme across the UK, and we're using all sorts of different routes to get to our audience. And as Caroline mentioned, our advisory group have been particularly helpful in guiding us to access those relevant groups. We'll oversee the recruitment process, as I said, and we'll also ensure that you have the right number of suitable candidates to interview. We have some interview guidelines and questions if it's helpful, which we can share with you. And we'll also manage the education and cohort activities across the programme. So as Caroline mentioned, we've got our online platform, and we will build a cohort within that platform so that the students can share knowledge and build their networks. We'll have some dedicated training programmes, and we'll also look at the career stories, etc., that we did last year, and look at how we can build on that. And there'll be a competition running through the 8 weeks with a final presentation at the end. Depending on circumstances, that might be a face-to-face event, but we'll work that through as time progresses. But ideally, we'd have a face-to-face event at the end. And so what do we need from you? We'd ask you to manage the interview process. As I said, we can provide some guidelines for those interviews, but you make the decisions about who you want to recruit. You find a suitable project for them and provide them the necessary skills and training to deliver that project. You organise their contracts and pay them at the London Living Wage or higher. You find a line manager and a mentor for the interns. And you'll determine whether you want that internship to be online, face-to-face or hybrid. And I can have those conversations with you in January about how you might want to run that programme. And then if you are looking at face-to-face, then we can make sure that your your pool of candidates are sort of geographically close to you as far as we can. And we're really asking you as well to support us in delivering the topics and speakers for the training and cohort activities. It makes it for a really rich experience. And also, if the interns do require a laptop, that you do provide one for the duration of the internship. I don't think many were required last year, so hopefully that's not a problem. Next slide, please. And this is our advisory group for 2022. And as you can see, that's grown. And the reason that's grown is, in particular, we have 4 of our interns from our 2021 cohort on our advisory group. And they've been absolutely fantastic in helping shape the programme for 2022. So a really great addition to the advisory group and making the programme for 2022 even better. Next slide, please. So next steps, we really like you to confirm the numbers that you'd like to take by that January deadline. If you can't, that's okay. We were looking really for a commitment to the programme at that point. If you have further questions or you want to have a call to discuss anything you're not sure of, please do get in touch. And we will be arranging a meeting for late January just to discuss next steps in the programme. And we're really asking you, please do spread the word, encouraging others to take part, whether as hosts or as candidates. That's it. Thank you very much.
Wonderful. Thanks, Sarah. So really at this point, we want to kind of open up questions that you have as a group. Do we want to, Sarah, thank you for starting us off. I was just looking at some on the chat as well. Go for it, Sarah.
It would be really helpful to have an idea of the kinds of projects that people did last year, because it's quite hard to kind of say, oh, is this, have we got anything that would be suitable that could be done in that time frame? That's the thing that I'm finding most difficult to kind of work out.
Absolutely, we've got a list of projects. We can circulate those to the group. Yes, absolutely.
And I wonder whether actually this might be a nice opportunity for those who hosted last year. Perhaps if you could share just a very high level the types of projects that you gave the interns. So Neil, if you wanted to kind of chime in with.
Yeah, I'm happy to chime in. So we had 2 interns. I put in the chat that having 2 was very helpful, because even though they were had different skills, they were able to give each other support, which was very welcome. And in fact, they did different projects when they worked with the HDR UK. So we had them working on things that would be suitable for our participant portal. Because we couldn't give them identifiable data, but we could say, let's imagine this exists, what would you come and put into it? And so they went out and looked out examples and produced presentations on what other people were doing, how other portals worked, and they presented that to us. They did some mock-up graphs, they showed some localizations, because one of them was really interested in maps and that, and one was much more interested in facts and figures, so we worked with their skill sets. And indeed, we took on one of them straight afterwards until Caroline and HDR UK nicked him. So
hired him, Neil.
Anyway, yes. So effectively, we looked for something that we could do with de-identified data, and that could, capture their enthusiasm as well, because they came up with all sorts of ideas that we had never come up with, things that would be really good. So infographics and lots of modern technologies that some of us old fogies had never heard of. So that was really helpful. But it had to be de-identified data. That was the big thing, because they're working at home on their own laptops and stuff. So
great, thank you, Neil. And you're right. It's just like that's that breath of fresh air of people who are generations younger than you, seeing what actually is now the current technology is always quite helpful. Alicia, I think, did you have a question? You see on the chat.
I've forgotten what I've asked now. Yeah, can we specify that we're only giving graduate applicants, because I think we'd like to use it as a recruitment tool for more of a long-term contract?
So you mean beyond undergraduates, that they've done their first degree?
Yes, so if everything works out, then we continue their employment after the internship.
So effectively, you wouldn't therefore want someone who's, say, in second year of university, because you want to be able to immediately recruit them?
Yeah.
I think that's probably possible, Alicia. Yes, I'll have a chat with you offline about that, but I think that could be done.
Okay. Can the SIFT also sift out those without the ability to work in the UK at the moment?
Yes, we should be doing that, yes. Well, yes.
And Alicia will be definitely in the kind of best efforts front. So I'd almost not see that people, so you will need to do your own proper checks and balances and things as you do the actual recruitment as it comes through on that. Good. There are more questions coming through. Ash, you sent a question around, actually, did you want yours about the number of interns per organisation? Is there a minimum or a max? Sarah, do you want to answer that one?
Yeah, ideally, would love you to take more than one. I think it's beneficial for the interns as well. But if you can only take one, that's okay. And I think Melissa put a question in the chat as well about the deadline for numbers. I mean, ideally, you can give us a good indication by early January, but we can be reasonably flexible as we go. It just when it gets to interview stage that we need a reasonable idea about how many you wanted to take.
Wonderful. Thanks, Sarah. And I've just seen a few people have had to jump off, but it looks like they'll be back in touch with various questions. Isaac.
Yeah, hiya. Question from me around what kind of technical level should we expect from the interns? Sure, it varies, but just trying to get a feel for what their coding and stats level is going to be like.
It will vary. We don't specify a minimum sort of requirement apart from that they've had to be studying in a university over the last couple of years. But most of them, we expect them to normally have some kind of science or maths background and some kind of analytical skills. But it's not absolutely mandatory, and you will get a range of applicants through to interview across all the different levels for you to choose from.
8 weeks just doesn't provide too much time to upskill in coding, so I don't want to pitch projects which are just going to be completely unreachable.
I think that the best option in terms of putting the project together is when you meet the candidates and you choose your candidate. I think then you'll have a good idea about the kind of level that you would want to pitch your project at.
Thanks.
Good. Any other questions that would be helpful at this point, or things that you think we need to be thinking about or helping you with as you're getting ready? I know that last time round, some people went in saying they'd want one intern and actually ended up taking several because they were so excited by the group that they met at the panel. So you may find your minds change as you go through the kind of recruitment process, and that's great. So we're obviously keen to get as many people into this field as possible. So if you are able to, that's fantastic. Lovely.
Rebecca's asked if we can circulate the slides so that they can circulate it out to people who are not able to attend today.
Absolutely, yes, no problem at all with that.
And we are recording this too, so we can always share that around.
Wonderful. Is everyone happy with the kind of sense of how the 8 weeks broadly will work? And does that all make sense to people in terms of any kind of queries around that at all? That's all good. And then the other piece is that once they graduate from next summer, we all kind of hook them up into a LinkedIn community so they actually can keep the relationships going. And one of the things that we'll be quite interested in seeing is actually how we connect the two communities, the 2021 community with the 2022 community. So effectively creating a kind of growing community of people who can support each other. It's quite an interesting kind of way as to how we can kind of grow that. Very good. Any last questions? And there are no silly questions, so please don't hold back if you've got something you're just not quite sure about.
Tamsin's put one final question in the chat about payment. Yes, Tamsin, we expect the host organisation to fund the placement, and it would be at London Living Wage.
Thank you.
And I have a question, sorry.
Oh, go for it, darling.
I just wanted to ask whether candidates can reapply, like if they had a placement last year, can they apply again to do a placement this year as well?
It's a great question. I don't see why not, in terms of if they're, I mean, I'd hope that they would be feeling like they could be moving on into the next stage and things on that. But yeah, that's an interesting question, Donna. Sarah, any views on that one?
I think we should leave it open. I wouldn't imagine many of them would apply again, if any, but I think it should be open, yeah.
You're right. You could imagine somebody saying, actually, I did it in one field and actually there was another organisation I'd love to get a chance with. So you could see it as a route into another organisation on that.
I have another question. Can I just ask, when will the placement be expected to start, and is there any flexibility in terms of when that might be?
So the placements start in July, 7th of July, across the 8 weeks. The programme will run according to that time scale. If you wanted to do something slightly different outside of that, that's okay. But the main activities will run according to that 8-week timetable.
Thank you.
Yes, at times, and we had some last year where people said actually they wanted to run it over a longer period of time. So we had the kind of core bit in the middle, which was the fixed kind of piece that HDI UK was organising, and then people did additional things outside that if they wish to on that. But that's entirely up to you on that.
Okay, thank you.
Alicia.
I was just going to add, I'd really advise trying to stick to those dates if at all possible. Our intern couldn't start until September in the end, and missed out on all the whole cohort feel of it all, and all the learning materials being part of something bigger.
That's a really good point. And because we just don't have the ability to run it again in that sort of way, yeah, it's very hard to recreate that for their experience on there. Very good. Well, huge thank you all for kind of putting yourselves forward and getting involved in it. I think you'll find it's a lot of fun. So everyone who was involved in it last year really enjoyed it, and left with kind of really quite inspiring experiences, lifelong friendships, relationships, and things that it's just creating opportunities for us all to connect with new people in new ways. So thank you so much for getting involved, and I think it's going to be a great year next year. So thank you so much. Take care.
Thank you.
Cheers.
Bye.